Hello, Linda Taylor, Taylor Your Insurance. This is our third and last part of how Medicare works, Medicare Made Clear. It is an educational meeting. This book is put out by United Healthcare, but it doesn't say anything about the any of their plans, so that's the education part. I hope you have enjoyed the part 1 and part 2. This is part 3, and we'll get right to it and have some fun looking at kind of wrapping up some of the loose ends that we've had. Okay, if you'll turn to page 9, just to revamp ways that you can get Medicare help. Number 1 would be, and the most effective, is Medicaid. If you make below a certain amount, you apply to the Medicaid services place. It's worth a try. If you make below a certain amount of money, you can call them and get all of the extra amount of information that you need. And then you would qualify for dual eligible, which is Medicaid and Medicare services if you're at a certain age or been on disability for 2 years, or have taken the disability, back. The court has taken the disability back for 2 years. But anyway, it's called a dual eligible person, and that Medicare or that Medicare Advantage plan, gives you a lot of extra services. Your Medicaid usually covers most things, but it doesn't cover, Medicare itself doesn't cover eyes, ears, teeth, and feet. And Medicaid does cover a little bit of some of that, but the dual plans cover a whole lot more of all of the above, plus some extras. So they're very nice to look into, and usually at no cost to you. Then we talked about extra help. That is where you can get your medications at very low copays, and the premiums for the medication plans are usually at no cost. The other 2 we don't have in the state, so we won't talk about those. And you can always go to Medicare.gov to learn more about that. The next page we'll go to is 11. And, well, 10 and 11 actually. These are just the different ways you can get Medicare, and it's just a revamp of it. Any way you do it, you get the Medicare extra coverages, then you are able to save those skyrocketing prices that you could have on regular A and B and D coverages. There are no caps to A and B. So remember that. It maximizes your out-of-pocket expenses. So there, 11, you do have to get in at a certain time during IEP or your initial enrollment period. You can change plans for the Advantage plans during AEP, which is number 7, your annual enrollment, the October 15th to December 7th. And then you have special enrollment periods during the year if you have a qualifying event. If you have Medicaid, there's several different times. If you get qualified for special, for the extra help, if you have a special or a chronic some kind of chronic condition like diabetes or heart or renal failure, all of those things are special election periods that may qualify you. If you decided to work past 65 and you decided to stop your job, then you get a chance to enroll in a Medicare plan within 60 days, a couple of months, after either the time that you decide to retire or you lose your insurance. Then every year, after annual enrollment, January 1st through March 31st, is what's called open enrollment. If you enrolled in something and you said, I don't like this, and you've had 3 months to look at it before March 31st, you can change your Advantage plan. And there are some restrictions on that, but we won't go into that. So anyway, let's skip to 19. Go a little bit slower so you can take some time to skip there. All these other pages are examples that you can read through. Very important is to know the different type of Advantage plans. One could be a health maintenance organization or an HMO. You need to stay in network. Make sure your doctor is in network and the hospital's in network. In Missouri, the HMOs are only like a few, very few hospitals that don't accept HMOs or any kind of Advantage plans. And so there's only like a handful of them. But they won't cover out-of-network expenses unless it's an emergency care situation where you have to be rushed to the nearest ER, urgent care, or if it's renal dialysis. So those are the three things that you can go to out-of-network hospitals for, but that's all. Health maintenance, HMO, you have to stay in network otherwise. You can you don't have to have a referral. Usually, some places you do have to have a referral. St. Louis, I think you do have to. A point of service, we don't have any of those around here. It's usually a hospital or a doctor has to agree to take the payment, and you have to kind of get that agreement up front. And you may have to have referrals in that. We don't have too many of those. A PPO, we do have those. And that is generally gives you more freedom. You can choose any doctor in or out of network, but you usually have to pay more if you go out of network. And some of them may require you to have a referral. So the special needs plans are your dual Medicare Medicaid plans, your long-term care plans. We don't have those in Missouri. They just go on either original Medicare or the dual Medicare Medicaid plans. And then we have your chronic conditions, either your diabetes or heart. Renal failure is going to be allowed next year. So that's good. Private fee for service is something that we don't see much anymore. You have to agree to the amount of service payments, much like the POS. And the POS has to have a referral. They may or may not, but the PFS plan is not, we don't have any this year, I don't think. And MSA, we don't usually have on any plans in Missouri. So the next page would be 28. 28. Okay, we haven't talked much about the Medicare supplement, so let's go to 28. The Advantage plan, remember it covers everything that Medicare A and B does and D, but it often has more. It covers usually eyes, eyeglasses, dental, podiatrist, and hearing aids, and offers benefits in those with some more, maybe chiropractic, different things. Now, Medicare supplement you pay just in case. So it covers your hospital, your co-insurance, and there's certain plans that cover more than others. But we're going to look at the plans right now in a minute. There is a deductible, and most of them after 2020. If you are 65 after 2020, there was MACRA. It was a law that came in that said you had to at least pay the deductible. But if you're 65 before 2020, you can still get the one plan that you don't have to do. Excess charges are charges that if you get a doctor that's not Medicare assigned, you might have to pay for that. That's a few plans, and we'll look at those again. Medicare supplements do not pay for prescription drugs, do not pay for long-term care, do not pay for eyeglasses, do not pay for hearing aids, do not pay for Dental, private duty nursing, or days in skilled nursing beyond the 100 days that Part A covers. Okay, now this is where I got confused the first few years I tried it. Part A, Part B, Part C, and Part D are your Medicare parts. Now they come along, and instead of calling them A, 1, 2, 3, 4, Medicare plan, Plan A, Plan B, Plan C, Plan D, Plan F, Plan G, Plan K. So if you'll notice, the ones that are offered now are, if you're over 65 January 1st, before 2020, you can still get Plan F, but after 2020, you had to, after January 1st, 2020, you're only eligible to get G. Plan F and Plan C are gone for people that birthdays after January 1st, 2020. F and G used to be the big ones. G usually costs less, and if F costs more than your deductible, which was 140, I'm old, 144.60, then a year, then Plan G made more sense. If you'll notice, everything is covered: Part A, Part B, co-insurance and co-pays, deductible, which was 144.60. Excess charges, if you happen to get a doctor that isn't Medicare assigned, and sometimes that happens. Blood transfusion, everything's 100%. Now, Plan F is no longer offered to people who are 65 after January 1st, 2020. But Plan G usually was enough, less expensive enough that most people got Plan G anyway. Okay. There are some restrictions on that if you're not in your initial enrollment period when you turn 65, or you come off of a job where you have to answer some questions. But if you can, Plan G is usually a good alternative. Now, the other ones have a lot of white spaces in here, if you notice. Some people go to N, but they have some charges. They can have some co-pays at the doctor, and they can get some excess charges if they happen to get a doctor who's not Medicare assigned, maybe in an emergency situation in an ER, and the doctor is on call, and he's maybe being in training or something, and he's not an assigned doctor. There have been instances where people have had to pay 15% excess charges. So I usually just steer clear of that one, but you know, a lot of people do like it, especially if they're military and they just want something extra. It's not much difference in price. The other ones have a lot of white spots, and so they're just, you know, you can look at them and see and what agrees with you. But the most popular plan right now is Plan G. So they cover, just in case, they are, you know, as opposed to the Medicare Advantage plan, you pay as you go. This one you pay up front, not surprises. Plan G, you know, the only thing you'd have to pay at the first of the year is the Part B, as in boy, deductible. And that comes, you know, right at the first of the year usually, and after that everything is covered 100% except foreign travel, and that's 80%. But yeah, it is a pretty good plan. So you can look at those, and if you have any problems, you can let me know. Some companies offer an F and a G high deductible. That's a good plan for if you don't get sick very often, and sometimes it's you know, it has a high deductible of $23.40. Once you meet that, you don't pay another dime, and it's probably a third of the price of the regular F and G. So it might be worth looking at if you you know, don't mind paying that deductible. But a lot of people, G is getting down to where it makes sense to just do that if you like it, and go from there. So think that's about that for the pay, just in case. You know, if you get sick and you don't want to have to be bothered with paying doctor bills and such when you walk into the hospital. Okay, the next one is 32. We'll buzz through these pretty much. When you turn 65, you have 3 months before, the month of, and 3 months after to get enrolled in a plan. You need to, of course, as soon as you can, as soon as you start getting the letters and saying you're ready for to sign up for your Part B. And a lot of people are now getting the Part A and B already sent to them. And they say, if you don't want this, you don't have to take it. Just send it back that you don't want it. Every year, you have that open enrollment, of course, and then if you missed your initial enrollment period, you do have to wait till July to pick up your Part B. So you don't want to miss that 3 months before, 3 months after, and the month of your 65th day. So okay, the open enrollment for the Medicare supplement in most places is 6 months after or before you turn 65 or enrolled in Part B. So, and you can pick that up if you stop your workplace. Okay, the next one is 34, special enrollment period, working past 65. 8 months to enroll in Part A and B, or both without a penalty. This is true if you're covered under your spouse's or your employer insurance. You can enroll in Medicare Advantage Plan Part C or prescription drug up to 2 full months after the month your employment or employer health insurance ends. You don't want that gap. So, okay, 63 days to be exact that you have. Okay, 35, we talked about some penalties. Part A, most people go on and get that, but it's if you didn't sign up and get it when you should have, it's 10% of the premium amounts charged every month for twice the number of years enrollment was delayed. Part B, it's 10% of the premium amount for 12-month period enrollment is delayed. It's charged every month for as long as you have Part B. The Part D is 1% of the average Part D plan premium for every month you delay. You pay the penalty for as long as you're on Part D. So even though you don't take medications, remember you want to get on that unless you get extra help, and that will be, or you have credible coverage like military coverage, you don't have to pay that. So. The Medicare supplement, the time to get on it is when you're in your initial enrollment period. That's guaranteed issue, or you come off of your plan with your plan with your employer. There is a bit of a glitch there. If you've already had B, you might not get guaranteed issue. There's a couple of 3 things in there that we just have to look at. I forget them. I just have to look them up every time. But you know, that guaranteed issue is big because otherwise you may have to answer questions. So if you're ever going to get a Medicare supplement, you may want to do that right off the bat if you decide to do that, so you don't have to answer questions. On the Advantage plan, you don't have to answer questions. So every year, you might always, especially your drug plan, you want to look at it between October 15th and December 7th. October 15th to December 7th. Always check especially your drug plan, and make sure that your medications are still on it. You'll receive a letter sometime before that called an ANOC, annual something or another, annual outline of coverage, ANOC, and it'll tell you if one of your medications isn't going to be covered, or a doctor isn't going to be covered, or something. It tells you all the things that changes NOC letter. And don't throw that one away because it's pretty important. So if you needed to make a change, if your hospital or doctor was no longer going to be in network, you want to really save everything from your insurance company. So in case you needed to make a change during that time. And then it will start January 1st of the next year. Okay, the next page would be 37. 37. And then every year, starting a couple of years ago, is what's called open enrollment. And you get from January, February, March of the next year, say you got in an Advantage plan in annual enrollment, October 15th to December 7th. And you have January, February, March, and you can't stand it. You can't, you find out a drug isn't covered. You find out your doctor or your hospital's not network. You just don't like it. They won't get back to you. You have 3 months to change to another Advantage plan or go back to original Medicare A and B and get a drug plan. So that's a biggie. A lot of people forget about that. That's an open enrollment when you can change plans. If you don't like it, there's no problem. You just say, I want to go back to either, or you want change to another Advantage plan, or you want to go back to original Medicare in a drug plan. Okay, that's what you change to. If you just don't like your drug plan and you have a supplement, you're stuck, but it's for Advantage plans. So right there. Okay. All right, you. That's about it. There's a little bit of a, just a reminder of what you have. Remember that I'm here to answer any questions. You can pick up your hard copy book or get the link and learn what Medicare, how it works. This is, again, the third part. First and second are on at the library, Rolla Public Library, or it may be shared with some other libraries. If you want to know how it works, it's fun. It's not scary. You got me. Just give me a call, give me a text, give me an email. I'll try to answer all your questions as best I can. Or we'll go somewhere where we can answer, online or to Medicare.gov where we can answer your questions. I just hope that I've taken some of the scariness out of it. It really, I think sometimes you just get inundated with so much information when you turn 65 that it's just overwhelming. It's not scary. It's just the very basics of this book. Will walk you through it. And if you have any question, again, I work nights and weekends, 573-578-5333. Feel free to text me, call me, whatever, and I will try to help you as best I can. Thanks so much, Linda at Taylor Your Insurance, and I'll be happy to answer any questions I can. Thank you.